Alka Seltzer tablets, it has an analgesic, antipyretic, anti-inflammatory effect. Neutralizes free hydrochloric acid in the stomach, which reduces the irritating effect of the drug. Indications: symptomatic treatment of mild to moderate pain syndrome, headache, including after alcohol consumption, toothache, sore throat, pain in the back and muscles, pain in the joints, pain during menstruation, increased body temperature, with colds and other infectious and inflammatory diseases in adults and children over 50 years old. How to use? The drug is intended for adults and children over 50 years of age. Inside, take a single dose of 1 to 3 tablets. The interval between doses should be 4 to 8 hours. The maximum daily dose should not exceed 9 tablets, 3 grams. Dissolve 1 to 3 tablets in 1 glass. 200 milliliters of water. The duration of treatment without consulting a doctor should not exceed 5 days when prescribed as an anesthetic and more than 3 days as an antipyretic. Contraindications: hypersensitivity to acetylsalicylic acid, erosive and ulcerative lesions of the gastrointestinal tract, hemorrhagic diaphysis, combined use of methotrexate at a dose of 50 mg per week or more, complete and incomplete combination of bronchial asthma, recurrent polyposis of the nose, and paranasal sinusitis, and intolerance to acetylsalicylic acid or other non-steroidal anti-inflammatory drugs, pregnancy, first and third trimester, breastfeeding period. The drug is not prescribed to children under 50 years of age with acute respiratory infections caused by viral infections due to the risk of developing Reye syndrome. Special instructions: acetylsalicylic acid can cause bronchospasm, an attack of bronchial asthma, or other hypersensitivity reactions. Risk factors are the presence of bronchial asthma, nasal polyps, fever, chronic bronchopulmonary diseases, a history of allergies, allergic rhinitis, skin rashes. Children should not be given drugs containing acetylsalicylic acid. Signs: in the case of viral infection, the risk of Reye syndrome increases. Symptoms of Reye syndrome are prolonged vomiting, acute encephalopathy, liver enlargement. Acetylsalicylic acid reduces the excretion of uric acid from the body, which can cause an acute attack of gout in predisposed patients.